And as people trickle in, just go ahead and get situated. I won't be worried about that at all. So first of all, I'm really excited to be here as an attendee and to have had the opportunity to listen to so many awesome talks already. I'm also very humbled and feel very excited to be here as the keynote speaker as well. So today I will be talking to you all about how we can reshape the way that we approach and think about and work with difference, and how doing so will help us be more thoughtful and more flexible about the solutions that we deliver, the experiences that we design, and just the way that we work with people in general. I'm going to move my hand out of there. So before we get into that, a bit of background about me. I am a native Michigander, born and raised on the west side and living in Ann Arbor for about 8 years now. I am a user experience architect at Proficient Digital here in Ann Arbor. And that means that I am basically involved in all kinds of user experience work, from user research into information architecture, to wireframing, to technical specifications, like really the whole range of UX. So hopefully that gives you a little bit of perspective about how I'm approaching this. Before joining Proficient Digital, I graduated from the University of Michigan twice. First with my bachelor's in political science and sociology, and then with my MSI specializing in human-computer interaction from the School of Information. And one of my favorite things that I like to ask people is what they're trying to currently get better at or do better, whether it's in work or in their life. And two of the things that I have been actively pursuing and trying to get better at are accessibility and accessible design, and search engine optimization, or how to be a more SEO-minded practitioner. In addition to those things, something that I have been thinking a lot about recently, and by recently I mean about a year and a half, is difference. The reason for that is because about a year and a half ago, we had a new client come to our company and they presented us with a problem. And this company is Trinity Health, and they came to us and said, we have these 20 regional health systems. They're essentially the parent organization of 20 different health systems. And these health systems all have very, very different digital experiences. Can you help us? So on the left here, you can see these are just screenshots of some of the home pages of these health systems. And to give you an idea of what those health systems look like, it's anything from a single medical center to an entire health system with multiple hospitals, multiple ambulatory locations. It really is, it's a pretty mixed bag in terms of what types of organizations are within Trinity Health. And one that you might recognize if you're from the area is the third one down on the right. That is the St. Joseph Mercy Health System, and they are a Michigan-based health system. So this is what the landscape of our work with Trinity Health has looked like. We have been selected as their strategic partner, so helping them define their priorities, identify their audiences, and come up with the designs for the new experience. And Health Grades, formerly Influence Health, was selected to be their implementation partner, so their partner in technology and building these things. And on the right is a list of all of the websites that we had to consider in coming up with our solution. And as I mentioned, you can see even just looking at the names of some of those, how different they might be. We've got a home care system, we've got senior communities, we have health centers, hospitals, and entire medical centers. So our goal as their strategic partner, and in conjunction with Health Grades, as well as all of the clients that were involved in this, was to deliver a common set of tested page templates to help each of these regional health systems create a new site. So helping them streamline their experiences, come up with one common experience in order to have a new site. And that would all be on the same CMS or content management system platform. In terms of what Trinity Health looks like, the scale of the system, just to give you an idea of how big this actually is, they have health systems and their coverage is about 22 states across the US with over 94 hospital locations, 7,800 employed physicians and a ton more that are affiliated with their health systems. Over 130,000 colleagues. They have services in areas that have approximately 30 million people, so that's 30 million prospective patients, prospective users of these sites, and an $18.3 billion annual revenue. So as you might be kind of getting the feeling for here, this is a real hotbed for a lot of difference within the system. As we all know, the definition of difference is really broad. It's really general. It doesn't give us much information about what we can do with it or do about it. So difference is essentially what distinguishes things from one another or establishes them as dissimilar. Throughout my work with Trinity Health and just in things I've observed, I've taken that definition and tried to identify what are the different types of difference? What is difference comprised of? And I've come up with these three main categories of difference. First is attitudinal. That's how people see and experience the world, their perceptions, their goals, the things they prefer, what their priorities are. And I have examples down below, and these are things that are from my experience with Trinity Health, but these might not feel that unfamiliar to you. These might be situations that you found yourself in. So for attitudinal difference, that might look like you're working with multiple stakeholders and they have varying opinions about what the goals of the project should be. How are we going to approach it? What our priorities should be? What are we trying to accomplish? Next is technical difference, and this is really about systems and technologies, and within those, different things like content or design, functionality. This might look like having a whole lot of content or tools, integrations, different site architectures, and needing to come up with a streamlined solution that can encompass all of those. Finally, operational. This is really about how people are organized or how a system is organized. Structures, processes, abilities, capacities to do certain things, requirements or regulations. These can be legal requirements, they can be governmental regulations, and this might look like an approach that needs to work to account for all of those things across different teams. And obviously, there are other types of difference. These are just three of the main categories that I've identified, and maybe you have too, in just the different types of work that you've done or your different experiences. So obviously we're starting to unpack difference, and we're realizing that there's a lot more nuance there than maybe we're led to believe just by that one single broad definition. But the way that we approach difference is typically, we see it as being antithetical to a lot of the things that we try to accomplish or try to embody in our work. These concepts like cohesion, how well things fit together, how well things sit to a pattern, or how well they are structured, how simple they feel, how straightforward. We see difference as being a wrench that's thrown into some of these approaches or these things that we want to embody. As a result, we often seek to, or are asked to by our clients, we're asked to streamline. They say, hey, we have all of this difference, let's winnow it down a little bit, make this less for us. Reducing, so making difference smaller, not necessarily a smaller amount of it, but to make it less prominent or make it less significant. And eliminating it, just get rid of the difference. We don't want it. It's complicating things for us, it's too much for us to maintain, let's just get rid of it. But when we do these things, there are implications that we run into. So when we try to streamline difference, we might be trying to reconcile differences or different aspects of a problem that we really can't adequately resolve by doing so. We are trying to fit things into a single solution or a single outcome that it's really not meant for those things. It's like trying to fit a foot into a shoe that's just not ever gonna fit. When we try to reduce difference, we are oversimplifying the root causes of it, and we're minimizing the impact that difference can have in play. We're saying, hey, this isn't so important, let's deprioritize it. But that means we're making it smaller when it isn't necessarily meant to be small, or it's just not small inherently. And when we try to eliminate difference, we're kind of disregarding or just brushing off the fact that difference exists for a reason, and there are key sources of difference that might have a really important role in what we're trying to do. As I mentioned, difference often exists for a good reason, or for many good reasons. We know that that's not always the case. Sometimes differences exist just because we're incumbent to them. They're just there, they just happen. But a lot of the times there are reasons. So how do we become better agents of difference? What can we do about it? We know that it exists. We know that it can be really important. We know that our gut reaction to difference isn't always productive. It doesn't always do justice to our processes. So what do we do about it? So I've come up with a framework with 3 different pillars as to how we can be better agents of difference. First is putting people first. We've heard a lot about empathy today. We know that that's something really central to our work. So I'll touch on that, but I also want to encourage you to think of this in a little bit of a different way, not necessarily just trying to understand our users and their goals, but trying to understand what makes them different, not necessarily creating generalizations of, we know most of our users want this, we know most of our users do that, but where are the idiosyncrasies? What about the users that don't do that? Why is that? And what can we do about that as designers, as people providing solutions? Next is identifying difference and when it matters. If we want to do better about difference, then we have to have a toolkit for how we can find it and how we can decide what we're going to do about it. And third is the power of best guessing. As people that are often turned to as the solution providers or the people with answers, a lot of the time we feel like we have to come up with one single solution, but the point of this is that sometimes we need to be using a best guess and leaving room for flexibility so that we can use that to be more thoughtful about how we're approaching a problem and what we're going to do about making sure we're doing justice to difference. So putting people first. We all experience difference in our own contexts, in our own worlds, in our own jobs. However, we can't really objectively understand or experience difference the same way that the person who's doing it is doing so. So I can't tell you what it feels like for you to be different in the ways that you're different. I can't do that with a client. I can't tell them, hey, I see that you're different in these ways, and that's what it means to you. We have data. We can see what makes them different objectively, but when it comes to their experience, we have to rely on people to do that. So instead of making assumptions or trying to do it alone, taking that big task on ourselves, we should be relying on our stakeholders, turning to them to say, what are your priorities? Why are those different from someone else's? Why are they different in a unique context? We should be relying on our users. As I mentioned, not just to identify their goals or their needs, but to see what makes them unique. How does their experience change? How, if we're presenting different experiences, do they perceive that? And how do they react to that? And what does that mean for them as they interact with our product? And finally, with our colleagues. Obviously, a lot of us are UX people or touch UX in some way as product people, project managers, content strategists, but we should be leveraging the disciplines that we work with more often. And not just to say, you're doing your work, I'm doing mine, how do we meet in the middle, but to get their perspectives and see what we can learn about them as we're coming up with our solutions and our approaches, because everyone has their own perspective, and a lot of that is a result of their expertise in their specific discipline. So for Trinity Health, getting back to that example, the way that we used our stakeholders was first with an initial discovery. We got all of these different health systems represented, we had a lot of them in a room together and had to identify what they were trying to accomplish, what their goals were, what they thought their users were, and figure out where the differences existed. Throughout the whole process of working with them, we had a really strong emphasis on continuous engagement. So from the very beginning, having frequent meetings and reviews with all of the clients. And at times this looked like 50 people on a wireframe review, which you probably can guess how well that went. But the important thing for us is that they were able to express their voices and they were able to raise their hand when something didn't sit well, or when they knew a situation or an experience that we were trying to deliver or a feature wouldn't apply to them. And what's really important about that is it helped us figure out where we needed to be more flexible when working through our process and our designs. And third, we have conducted in-person meetings with each of these teams. So we conducted a lot of work at the global level, but we've also carved out time in our project to go and fly to destinations and be in person with each of these health systems to talk to them about what does make you different. What are you trying to accomplish? How are we going to get you from where you are into this new experience? And that allowed them to realize that we are your partner, and we're not going to try and streamline everything, fit you into a solution that's not meant for you. Instead, we're going to make the solution work for you. Then engaging with your users or using your users. First, we had a lot of survey data, so we were able to formulate personas that we could use throughout the process, and we could always go back to those. I'm sure you're all familiar with how we can use personas, but this was a really big part for us because we were able to get all of these health systems to align on a common set of personas. And they could all say, okay, that might not be our main user, but we do have users like that in our system. And when we're delivering things like wireframes or identifying how we want certain things to work, their content, we can always go back to those. Next, we conducted 2 rounds of user testing of their live sites and of the wireframes. And the one that was particularly interesting is this live user testing. We tested 5 existing sites to identify what users were struggling with and how those struggles might be different across the sites, but how they might be the same. We wanted to identify where people were getting hung up, as well as what worked well. We also conducted card sorting. Since part of our project was to deliver a high-level site architecture, we had to identify what content categories would make sense. And when you're making decisions for 20 websites, you obviously want to make sure that not only will it hold water in one case, but it will as you get to some of these differences in the systems too, that it was flexible and could kind of change to adjust to the needs of those health systems. Next, using your colleagues. For us, this looks like a multidisciplinary team that is pretty well dedicated to the project. We don't have questions about who do I ask when I need a perspective on visual design or accessibility, or I need some help with identifying how this ladders up to our strategic goals. We're all very involved. We make it a point to prioritize giving feedback to one another and collaborating internally. This also was important for us in working with the development team. We, from the very beginning, involved them in our wireframe reviews to make sure that we weren't recommending anything that they couldn't execute on, and that was especially important since they were a separate company, but also just having an open dialogue with them about, hey, this isn't working right, I think we need to rework this, and getting all of the perspectives, technical, strategic, even just at the account level as well. So obviously, besides just talking to people, there are a lot of different ways that we can attempt to identify and visualize difference. What you're looking at over there this is a content gap analysis that I conducted of all of these different Trinity sites. So this is 130,000 plus pages mapped into content categories and then displayed across bars to show what the different proportions of content were on each of those sites. So each of those bars is a single site. Each color represents a type of content that they had on the site. And what you're able to see here is where some of those differences exist. You can tell, even just looking at the first bar and the second one, from pretty far away, you can tell that those look very different. And once you identify some of those things, you can dig deeper into what does that mean? Why do those differences exist? What does that look like when it comes to delivering a product? So taking back to those 3 different types of difference, I've identified just some methods that might work well for trying to identify difference within them. So for attitudinal difference, obviously for this, it's about talking to people, identifying how they think, how they feel, what they want. Surveys, interviews, workshops, even attitudinal plots where you're kind of representing those things, or Venn diagrams. Technical, things like content analyses, audits or inventories, process flows, And again, Venn diagrams, you're going to notice some overlap. This isn't exhaustive. These categories aren't mutually exclusive, but it's just supposed to give you a sense of what type of information might help me in trying to identify these differences and what can I do with it. So the middle, technical, data is probably going to be something that's important for that. And finally, operational. This is about your systems, about your structures. So again, hearing from people how those work, why they work the way they work in interviews or surveys, and representing those things in process flows. You can also use documentation that companies might provide about their processes to better understand how they work. But while that list isn't exhaustive, what I would really encourage you to do is to be the master of your methods. Identify what you want to know, what you're curious about, where you think difference might exist, and come up with a method that makes sense for that. So here we're looking at down the left, that's each of the different websites, and across the top, those are potential navigation categories or items. So what I did here was I mapped each of those categories according to where they existed within the site's navigation. So what I was learning through the content audit is I can see how much content you have. I can see how much you have relative to your entire site of content, but I couldn't identify what was important to these people. And so I had a hypothesis that maybe these navigation schemes would be a pretty good indication of what mattered to each of these health systems. So by mapping this out, you can start to see some of the trends. On the left, those are categories where there really wasn't a whole lot of contention. In the middle, you can see where things get a little bit squishy, where there are a lot of different colors. And so in having to identify what a navigation scheme might look like, this was a method that I could rely on and that I had to come up with to get a sense for how much difference is there, what does it look like, and then decide what to do about it. So for Trinity Health, those are only two of the things that we did in our research and discovery, but some of the main differences that we identified just throughout our time with them were things like team size and composition. You might have one health system where they've got a single webmaster and they do everything on the website. We also have systems where they might have 10 or 15 marketers where those people can serve as the subject matter experts. They can have very specific roles, and that those people need different things. They need different support. They have different bandwidths to support different solutions. Next, they have different priorities and key programs. Some health systems are very research and education based. Others are more about volunteering or their community benefit. Next is data and structure. Obviously, we've talked about this a bit. Single hospital sites versus entire medical systems. For those who are familiar with St. Joseph Mercy here in Michigan, they are a statewide hospital system. They have 5 main hospital locations, and it kind of stretches all the way over to the west side of Michigan where they have even more. So we knew that we couldn't have a solution for them that's going to look the exact same as a single hospital website will. So that's where you start to identify how are we going to modify our approach, or how are we going to leave room for flexibility so that we can better account for those things and have a solution that does justice to them. Next is brand and identity. Each of these hospital systems and medical systems have their own identity. They have their own voice and tone. They have their own colors. They've got their own brand standards. And this wasn't something that we knew we wanted to streamline, just because it's important for them to be able to express those and one of the parts of this project for us was to allow them to better express that by enhancing their brand. So creating templates that would allow them to do that. And finally was digital maturity. We saw a lot of difference in just how ready people were for some very technical solutions, some very complex integrations, or just how much they use their website. We can't really assume that all marketers are going to use the website the same way as everyone else will. Some people used an agency and had the agency help them with their website because their internal team wasn't quite ready. So we know that difference exists. We know that it matters. We have methods for identifying it and helping us kind of get our arms around what it looks like. But what do? We can't just categorically say, cool, all differences in. We're just gonna let everyone do whatever they need for exactly they want. So what you need to do is figure out how to strike a balance between sameness and difference. So how do you establish things that are common but allow for the proper room for flexibility? So some things that you might ask yourself. Do the differences matter to your goal? Do they matter to your users, to your stakeholders, to what you're trying to accomplish? If they don't, you might not need them. If they do, then you should probably look at them more seriously. Who's affected by them? If you keep them, who will be experiencing them? How will that affect those people? And if you get rid of them, who will miss them, if anyone? Can you do anything about them? Sometimes differences exist, but we can't necessarily touch them, or we shouldn't, because it's part of a legal requirement, or it's part of your process and they just have to be there. Are they worth any associated extra effort or money? This is the perennial question of, is it worth it to do this if it's going to cost this much money or take this much time? It's always the cost-benefit analysis that we often see. And what existing similarities or differences can you leverage? Rather than attempting to take what you have and turn it entirely up on its head just because you can or because you've identified that these differences exist, are there things that you can leverage? Are there differences that are common? Are there similarities that you can maintain in order to help ease some of the burden of trying to figure out what to do with them? And this is what balance might look like. It really depends on your threshold for balance. It depends on your budget. It depends on how much you're able to do, technical constraints. It might look like you have almost nothing that's the same and a whole lot of flexibility that you can use to play with. It might look like you have a ton of sameness, a lot of things that you can't change, that you can't modify, that have to be consistent, and only a little bit of wiggle room for sameness, or excuse me, for difference. And in that case, you really have to come up with what your priorities are, what matters the most, and going back to those questions, going back to your people and who this is going to affect, you need to think impact versus cost. So that whole thing is just a very complicated way to say it totally depends. I can't answer it for you. You might not be able to answer it for yourselves. This might be something that your stakeholders have to define. It could be something that's changing the entire way through a project and you don't know what the balance looks like until you're there. But flexibility is going to be our biggest tool for contending with difference. Because no single solution, no matter how good it is, no matter how well thought out it is, no matter how well tested it is going to be equally as good for two different things. It's just not going to happen. And that's just because that's the nature of difference and that's the nature of the world. But by making really strong guesses, we can get pretty close to something that will work. So I'm going to use a very simple real-world example just because I realize that sounds kind of pessimistic. So think about a shoe. We all have shoes. We all wear shoes. Let's assume that we're all tasked with designing a really good shoe. So we conduct research. We know who our customers are. We know what they're looking for. We know what features matter. And we think we have a really sick shoe that does everything they want it to do. And it looks the way they want it to look. The reality is, people will still need different sizes. They will have to change out laces if they can't tie their shoes. They might add arch supports just because their feet are a different shape. And at the end of the day, they might use them in different ways. Some people might wear them once, hate them, throw them to the back of their closet. Other people might wear them until the soles fall off. One person might use them in the garden, the other person might use them as their formal attire shoes. And that's not something that we as designers can control. That's the unintended outcome of creating products. And that's kind of the fun of it too. But this is where coming up with a best guess gets us close. That's what I mean by get it most of the way there and then leave room for flexibility. So for Trinity Health, these are the best guesses that we made. These are the things that we kept the same, pretty much. We did these things once, and we didn't really change them across health systems. So at the strategic level, we identified common project goals and common audiences. And these are things that we vetted with the stakeholders, with each of the health systems as we went. And we knew through our research and through working with them and by making them a priority in the process that we had the same goals and we had the same users. When it came to the experience, we had a common set of page templates. We conducted an audit of their sites and realized that these sites could be boiled down to some of the same exact page structures or page templates. Site architecture, we had to come up with one high-level framework that each of these sites could use to create their architecture. And while we didn't take it to the page level, we did identify that we could have something that people could mostly share. Next is the site data around physicians and just healthcare in general, locations, and different care options. We know that there are certain pieces of data that people have. We know there are certain pieces of data that people care about. And while those might vary at the health system level, we knew that we could have a pretty well-defined set of what those might look like, or even for some places, what their data could look like aspirationally. In the future, they want to have these things. They want to have more data because they know what their users care about. We also had one common style guide, which was a 123-page document put together by our incredible art director and visual designer. And this laid out all of the components that we designed for the system, as well as how to apply branding, how to choose images, how to make sure that once these sites were delivered, each of these health systems could do justice to their own brand, as well as the designs that we put forward. And finally, we had standardization guidelines. And this is something that we collaborated with the client on, so Trinity Health, not even just the health systems. But this was important for us because we needed to identify with Trinity Health what things should they be able to change. Should these health systems be able to modify their homepage? Should they be able to modify their navigation? And a lot of that feeds into their business rules, or should enhance the business rules, or their desires for each of these health systems and their experiences. These are the areas that we identified as needing to account for differences, or where we needed to have those differences represented. At the strategic level, structural complexity, health system versus hospital, and making sure that we had solutions to accommodate either of those. Health systems support needs and budgets. Some health systems work with a different agency for things like their assets, their SEO, their campaigns. Other people wanted to use us to help out with some of that stuff. So that's where there's some flexibility in identifying how can we best be your partner. Experience level, things like content. We can't tell you what content to put on your site. We could, but since there were so many sites, it wouldn't make sense to have a common set of content. Branding, identity, and assets, again, that's all part of who they are as a system, and that's for them to express. Architecture modifications, we did allow a certain level of flexibility with the high-level architecture as well as down to the page-level architecture for each of these systems. And that's just because they're structured differently as health systems, and so their architecture of their site should reflect that, but keeping in mind the information that we had from the users, from the card sort, and from our high-level architecture that we delivered for everyone. And finally, things like integrations. These places use different tools, they have different portals, and those are things that we can't really touch, not easily and not at this level. So looking over to the right, you can see this is the same page template, essentially, but there are differences in data where some places might not have images, so we have different styles for that. There's a check-in to the emergency room online component for the one up front, because that was an integration that a system had. So making sure that not only acknowledging the differences exist, but having a plan for what we can do about them and how we can represent them. So for anyone who's curious about where this project is now, we launched our first site last November and have since been kind of tweaking it and making it better, and are now launching 2 more sites in the next 2 weeks. We have 7 sites underway right now, and Trinity's also been using us for some additional engagement and support on other projects too. So that is Trinity Health as it stands. And I want to jump back quickly to this framework that I shared with you all earlier of putting people first, identifying difference and when it matters, and the power of best guessing. So just recapping what that looks like. Putting people first is seeking understanding and really leaning on empathy. Hearing it from the experts. We're not the experts, we know that, or the you experts. Using the people that are. Identifying difference and when it matters. Change the way that we approach difference. Just rethink it a little bit even and see if you can identify more opportunities for flexibility. Relying on our methods and not being afraid to use new ones. And striking a balance between sameness and difference, whatever that might look like for you or what you're trying to accomplish. And lastly, using best guessing. Recognize the shortcomings of our work. Recognize the shortcomings of our solutions, but use those as opportunity to embrace flexibility and incorporate flexibility and have that inform kind of the complete bar, if you will, of sameness and difference. And I know that this has just been a single case study of Trinity Health with this framework, but this does apply to other areas and other disciplines as well. So thinking of ability and disability, or different social and cultural contexts, understanding those and what we can do about them. Technological access and capabilities, needs, goals, or priorities, people's attitudes, some of those social considerations. If we think about putting people first in each of those cases, using people as the expert to tell us, what is your experience with this type of difference? Identifying it and when it matters, using appropriate methods to say, okay, what does difference look like? What can we do about it? How do we find balance? And finally, using best guesses, acknowledging that difference exists, and making a best guess to get us most of the way there, but leaving room for flexibility. So, finally, eliminating or diminishing difference implies that sameness is preferable. By saying, let's get rid of or make difference smaller, we're saying we want more sameness. And instead of doing that, we should be better embracing difference, putting people first, choosing our methods strategically, striking a balance, and using best guesses. Doing so will empower us to be more user-centered, to improve our flexibility and the intentionality of our work, and to deliver more thoughtful solutions and experiences to our users. Thank you. We have time for questions. Yes.
So I have a quick question. So I do really appreciate you show so many different techniques. I'm particularly interested in, I think it was slide 19. So you show like a bar chart of defining different content. Yeah. This one. I was wondering, like, when you were going through different sites, how can you define the theme of that page?
That's a good question. So she's asking how, when conducting this analysis, could you identify what those categories should be or what the theme of the page is? This was a very manual process. So starting off, I conducted a crawl of each of the sites and had them as separate Excel files. And a lot of it you can try to infer from the URL structure or the page name. So once you identify certain categories using potentially navigation categories, so about us, for example, then you can search through Excel and kind of flag those items. And it took 2 passes for me to go through and say, this is a more specific category, this might be our history, this might be our mission, and then going back and coming up with the high-level buckets. So shortcuts were using the URLs, the page names. Not all of the sites were well-structured, so that was difficult. But for things like doctor profiles, those are pretty easy because you could search for DR or certain credential acronyms and then find those and categorize them that way. But it's not perfect. Obviously there's overlap between some of the categories, but that wasn't, the point of it wasn't to be like each page is flawless. I think I had to manually categorize just a few thousand pages once I could kind of do that in a more automated way. And then it was just a matter of looking at the page, identifying what is the content, what are they, who are they talking to, what is it trying to accomplish, and where do I think the best fit is.
How long does that take for your team to finish this?
This took probably about 2 weeks.
Okay.
Yeah, and it was just me working on it too, just for the sake of making sure the categorizations were consistent. Just we didn't want to have multiple people perceiving them in different ways, but yeah, probably about 2 weeks. It was actually really fun. It sounds painstaking, but it kind of turns into a game, so.
It's very impressive.
Thank you. Mhm.
So fantastic talk about your talk. So first of all, I think that I would ask you a question about a little bit irrelevant to the topic that you choose. I was thinking about fun part, how to make people to have fun when they press the button. How to make people to have fun, which is irrelevant to hospitals because people with a terminal disease will not care much about fun more than saving their own life. So to use your framework, the working framework, for more site for fun, what kind of process that we emphasize more to use your framework?
So in identifying how users can have fun with an experience, I think it's important to identify what are the different ways people conceive of fun. How do I experience fun? What gives me joy? What does that look like in terms of coming up with a UI solution for that? And it might be that you talk to people and find out that a certain label resonates really well, or a couple of different labels resonates really well. And the problem about fun is how do you quantify it? So how do you test it? If you implement something and you A/B test it and see, I think I have these 2 really fun labels, which one's more fun? Then you could do it that way, but it also does come back to how are you going to measure it? And then, again, leaving room for flexibility, testing it out, trying different options or taking those in front of users and saying what they prefer. Yeah. It's an interesting question though, because healthcare is not always that fun.
Yeah. Thank you very much.
Yeah.
So you were talking a lot about similarities and differences, and striking that balance, and it's not the same for everyone. It seems like there would be a lot of negotiations involved, maybe even with yourself, maybe between you and other people on your team. And in a lot of successful negotiations, there's something where you find more resources than you were actually expecting, like expanding the pie, if you will. And I was wondering if you could share one experience from your work on this project where you were able to do that.
So I'll share an anecdote that is perhaps a little contentious for our team, but I think it does a good example of saying, we have people who have differing opinions, and what do you do about it when you know you have to come up with a single solution? So we were coming up with the original wireframes, and we'd come up with a sub-navigation, so within kind of one level down into the site, and we needed to have a structure for that within a channel page. So let's say you click into About Us, and there's a category that you click into within that, and you get your options on that page, if that makes sense. And we'd had the idea of putting that sub-navigation on the right side of the page to encourage a user to read the content and then move to, here are my next options. Kind of prioritizing, the page should be what they're looking for. And we had a lot of the clients come back and say, we have a left nav, it works really well, and we want to keep that. We actually ended up doing user testing on the 2 options to say, okay, let the users decide what works. But we did have research about how should a page be structured, and the F content format or the Z content format. And the reality is you can't really change people's opinions. So that's also where using your stakeholders comes in, and having at the beginning a source of who's going to make the final decision if we get stuck. For us, Trinity Health was able to come in and say, all right, we need to come to a resolution here. We can't just keep spinning our wheels. And that's really natural when you have 50 stakeholders. So not just relying on your methods like user testing to figure it out, but also saying, here's how, if things get contentious, we're going to come to a resolution. Other questions?
One request I have a lot is for a communications plan. I'm wondering if that came up in your discussions, a communications plan internally for the rollout of the new websites. Did you have involvement with that? Was there a communications plan, or how was information disseminated to each of the different health systems or hospitals?
So the communications plan for the new site launches and the rollout, that wasn't something that we dealt with. That is something that the Trinity Health organization has kind of been involved with a little bit, but that's really been left up to each of the health systems. And I think part of that is just because we can anticipate that they all needed a different plan. Rolling out a hospital site is not going to be the same as rolling out a statewide health system website. So we really couldn't find a similar solution, or even just given the different contexts that they have. So we didn't touch communications plan. I do think that you could apply this framework to coming up with a communications plan, identifying, making a best guess of what are we trying to accomplish, how can we come up with a framework for a communications plan that we think is going to do most of what we want to do, identifying who are the different people that will read this, how might they perceive it, what types of different information are they going to need or different support will they need, and then kind of allowing for flexibility around that. But that's a good question, because I didn't have to do that, luckily, because I know that that process can always get a little bit, overwhelming. It's tough. Yeah. Yep.
Were there differences or needs from different groups or organizations inside Trinity that you were not able to accommodate?
So, yes. Yes, there have been. But what we've tried to do is set them up for a solution. We might not necessarily be able to, so I'll give an example. We have one hospital site in Syracuse, it's actually a whole health system, and they have an agency that builds their campaign landing pages. And they wanted these different campaigns to be integrated into their new site. And we didn't have campaign templates, that wasn't one of the pages that we delivered. They had these really gorgeous sites that just weren't going to fit into our site structure. So at that point, we had to identify, and luckily we have a lot of people to help out with this. We had to identify, what do you need these to accomplish? Who needs to be involved in coming up with the solution? And it ended up being a very development-focused solution where they engaged with the with health grades to kind of remake those templates for the new site. So there are certain things that we can't touch, but we are very fortunate in that we have a lot of different people that can help, whether it's Trinity, whether it's the development teams, whether it's us as their strategic partner, or just kind of having to throw the ball back to them. And there are times too where we're having to maintain certain things until we come up with a solution. So rather than redirecting to the new site, kind of pulling stuff over and knowing that we have to address it later on. Mm-hmm.
I was wondering if you encountered a lot of differences in approach when it came to two things. One, mobile approach and also accessibility.
Mm-hmm. Yeah, mobile was definitely a big one. We did separate mobile user testing as a result of some specific requests where we had clients say, I want it to work this way. What we ended up with actually is a bottom sticky nav, which is kind of a new convention, but it's a little bit more akin to native mobile apps. So we had a lot of questions around that, and we had research. We relied on a lot of research and did user testing so that we could point to that, and that's been really helpful. They've been incredibly interested in the research we've done, and we've been able to leverage that throughout our whole process when questions come up. Accessibility, it hasn't been as much of a topic just because we've made sure that it was part of our process throughout the process. Our visual designers are incredibly adept at that. We have recommendations in the style guide. And obviously since we delivered the templates and the clients input their content and they have some WYSIWYG functionality in the CMS, we can't actually control how they're gonna style everything, but we have made our recommendations and we have kind of everyone's eyes on stuff to make sure that we are doing our best. But I do anticipate that will be something that we'll conduct later on in terms of enhancements or part of a phase 2. Thank you.